Hi, Michelle, the Posh PA. Today, I am going to break down for you patient care experience versus healthcare experience, which one is important, and what counts as what when you are applying to PA school, because it is the number one question I get from pre-PA students. So let's go for it. But before I do, smash that subscribe button, because if you haven't already, I'm here every week dropping knowledge, dropping tips, dropping tricks for pre-PA students, PA students, and practicing PAs, so join me. Okay, so let's break it down. So by definition, patient care experience means that you have direct responsibility in caring for patients, whereas healthcare experience exposes you to a medical environment, but you don't have very much direct interaction with patients. So there's a lot of different roles that can be considered patient care experience. Some PA programs will list on their website what they consider to be sort of higher level versus lower level. But as a general rule, some very common ways to gain patient care experience would include being an EMT, a paramedic, a medical assistant, a CNA, a patient care technician, a physical therapy aide, a behavioral technician. And those are sort of, a medical scribe. Those are just different jobs and roles that are considered to be patient care experience. Now, I will say there is a little bit of a gray area with some roles like medical scribing and pharmacy technicians, where you may not be directly involved with the patients. And so it's very program dependent if they will accept medical scribing or pharmacy technician as patient care experience. So you definitely want to check with them before you apply and list that as patient care experience. Another one that can sort of fall into the gray area is clinical research coordinator. Now, me as an oncology PA, I think that's amazing patient care experience. Some programs may not consider that direct patient care, so just check with them for sure. And if you have any questions about if a program will accept it, reach out to them, look at their website, and see what they will accept as patient care experience. Now, healthcare experience to me is where you are not having direct responsibility for the patient, but you're exposed to the healthcare environment. So, patient transporter, you're delivering meals to patients. You work in the front office of a medical office. You do like paperwork, billing, coding, administrative work, in a healthcare setting. Those things all count as healthcare experience. Do you need both to apply to PA school? No. If you do have both, that's amazing. But I would prioritize getting patient care experience. And the list I gave you before is a limited list. There are many other things that would count as patient care experience too. Ophthalmology technicians, dental hygienists, nurses, for example. There are a lot of roles in which you have direct care of a patient, medical care of a patient, that will count as patient care experience. And so I would prioritize, as a pre-PA, getting that hands-on patient care experience, because that is what schools really want when you're applying to PA school. Having healthcare experience is amazing and will support your application as well. Now, some will ask if volunteer work counts as patient care experience. It certainly can, and there are programs that will accept volunteer patient care experience versus paid patient care experience. Volunteer patient care experience may include going on medical mission trips, or being involved in a local community that goes out and serves patients. So you would need to make that decision if you were going to list that as volunteer experience or patient care experience. And you would make that decision by saying, okay, I don't have a lot of patient care hours. I'm going to list that as patient care, or I'm going to list it as volunteer. So it really depends on what that looks like. Another question I get about patient care experience is, do I need a certification? So if you're a medical assistant, do you need a certification? No. There are a lot of doctors' offices that will train you to be a medical assistant without certification. You don't necessarily need the certification to count that as patient care experience, and you definitely want to list that as on your application. I was a certified nurse assistant. I did get a certification for that through the Red Cross. But again, but I worked as a patient care technician, but you don't need to have a certification to be able to get one of those roles unless the job you're applying for requires that certification. And so there are some certification programs out there that are now online that may, help you get through that faster if that's something you need or want to do. Phlebotomy is also another one that people ask me quite a bit. Phlebotomy does count as patient care experience. Some programs want to see a little bit more interaction than phlebotomy, but I would always list it as patient care experience as well. So I hope that you understand the difference between patient care, where you're in there and actively with patients every day and you're doing vital signs, or you're assisting with things, or, you're helping with procedures or things like that, versus you're just maybe, transporting patients around the hospital, or you're in a more administrative role. That would be more healthcare experience than patient care. So hopefully that broke it down for you a little bit more. And like I said, there are a lot of roles that would qualify for patient care. You need to check with your programs. You need to look at their website, do a little bit more information. You can always ask me too, and I can help you kind of figure that out. But hopefully this gave you a little bit of solid information on how to differentiate the two moving forward with your PA school application.